Hello, my name is Josiah Lancaster, and today I'll be talking about behavioral therapy. And in this presentation, this is the only way I could do it because I couldn't do a voiceover. But to start us off, we're going to be talking about what is psychological treatment. And as you can see here, psychological treatment refers to the evidence-based intervention that is designed to help individuals overcome mental health challenges that may be emotionally difficult or they may be suffering from behavioral problems. Now, there's two types of psychological treatment, and one type would be the psychotherapy, which is more talk-based, which is your traditional way of therapy, where people come in, they talk to the therapist. The therapist obviously jots down notes, and then they explore more about what they want to talk about on a deeper level and a deeper meaning to help them understand and grasp, what the root of the issue is, and they come together on what a plan is or goal is to solve this, right? And another type of psychological treatment would be the therapeutic interventions, which is just psychopharmacology, which is where they just prescribe you medicine, which I'm not sure how effective that is, but as we do know that the placebo medication for patients dealing with mental disorders is proven to work better than most. Now, why do people seek psychological treatment? People tend to seek this treatment just because they may be dealing with either long-term stress or a family reason, let alone they can be dealing with relationships that may be kind of heavy on them as far as, work, kids, wife, and even with that, other people may seek this because their healthcare provider require them or advise them to go seek that kind of help, and basically you can also go and seek this kind of treatment due to if you notice any sleep patterns changes or if you notice any dietary changes as far as you not eating enough or overeating. And then obviously your most obvious symptom would be a feeling of hopelessness and feeling of discouragement. Next is what is psychotherapy and the purpose of it. Basically, psychotherapy is a type of treatment that can help individuals experience a wide array of mental health conditions and emotional challenges. And the purpose of psychotherapy is to help a patient understand themselves better and to help them relieve emotional suffering or stress. And with that, with their therapist, they can help talk about and learn more about coping mechanisms and coping skills to help them overcome what they're going through. What I have here is what is the therapeutic relationship and why is it important. Now, the therapeutic relationship is just a relationship of a professional therapist with their client. And with that relationship, it's built on trust, it's built on safety, and it's built on helping them improve themselves to overcome or to help subdue or reduce their mental disorder that they're going through. Now, it's like I said, it's mostly founded on trust, safety, but as well as motivation and corrective emotional support. And with that, they go over plans and goals on how they can overcome the disorder that they're going through and to have a resolution on how to not go back to it. But the main topic is the behavioral therapy, which is what I've chosen to talk about. So what is behavioral therapy? Behavioral therapy is just a kind of more of a practical approach, which is where they use techniques such as deep, intimate conversations, and they help them with reinforcement. With that, they found that it's particularly more effective in improving adherence to treatment plans than medication regimens. Next is what does behavioral therapy focus on? Behavioral therapy focuses on problem focused, which just kind of targets the behaviors of why they're acting a certain way, why they feel a certain way, or really why they think a certain way or do a certain way. Next, the foundation that's built on is skill building, which that just kind of teaches, concrete coping strategies and techniques to help them not so much as reverse what they're going through, but to limit and to stop what they're going through, in a way of helping them whenever they across this problem or thought, or they see something that may trigger their behavior. They remember what they've learned in therapy, and then they apply it into their real life. And the next is just collaborative, which is just the therapist and the client, they come together and they create goals that they can achieve little by little to help them in long term see success with their disorder. Next is the background of behavioral therapy, which is, it was founded in the 1950s and the 60s, and the important people that helped founded it was Joseph Wolpe and B.F. Skinner and Albert Bandura. Now, the foundation of this is just learning theories and experimental psychology, and the reason was to have a more empirical scientific approach and dissatisfaction with lengthy psychoanalytic. Now, what are these disorders best suited for? What disorders are best suited for behavioral therapy? Now, my 5 disorders that are best suited for this are anxiety disorders, behavioral addictions, childhood disorders, and habit disorders, as well as sexual dysfunction. Now, with these, if you know anyone or have anyone that has tried therapy and none of the other different types of psychotherapy worked, I believe that behavioral therapy would be highly recommended for anyone dealing with such things as anxiety, as far as depression, and if you have behavioral addictions that may have a negative outcome, I would also suggest behavioral therapy. And a lot of these are just really just based on if you are feeling or you act a certain way due to certain things that trigger you. It's important to have a sense of, it's important you go see this kind of therapy to have a sense of what can you do whenever you come across this problem again. And that is my presentation. Thank you.